This summer, Jim and Barb Daggett will celebrate 1 year since Jim discovered he had breast cancer and had his left breast removed.
I don't like looking at myself in the mirror. And I guess I'm just very self-conscious of only having one breast.
QMG surgeon Dr. Christian Zwick says that typically only 1 out of 100 diagnosed breast cancers are in men.
But what happens is the cells that are in the breast, whether they be in the ducts or the lobules of the breast, can undergo the same changes that tumors go through in any cancer. So these ducts or lobules have changes, they become cancerous, they grow, and they can metastasize just like a breast cancer in a lady.
Jim's first sign of trouble was a lump in his breast that would not go away. Dr. Zwick, who specializes in breast surgery, says men and women both need to pay attention to changes in their bodies.
The most typical age group that's affected by this are men in their 60s and 70s. That's a little bit older than the typical females that are affected with this. But they may notice a change there. They may sort of put it off to just getting older.
Jim was diagnosed with invasive ductal breast carcinoma.
The most common type of breast cancer for men and women is invasive ductal carcinoma. It means it comes from the ducts of the breast. But the percentage of that occurs in men is much higher.
Jim decided against reconstructive surgery when he had his breast removed.
A lot of times I'll find myself pulling my shirt back over. It just doesn't fit the way it used to fit, you know.
Some men, if they have a little extra weight, you know, they might feel uneven after they have one breast removed. There's certainly reconstruction potential that they could have as far as whether it be an implant or expandable device, or they could even things out by having maybe a prophylactic mastectomy on the other side so that they don't feel uneven.
Dr. Zwick wants men to know that they don't need to be afraid of a breast cancer diagnosis.
The reason why people are doing so well with a diagnosis of breast cancer is that it's being treated aggressively and it's being treated very well in this area. And the recurrence rate is very low, the survival rate is very good.
Stephen Johnson, KHQA News, Quincy.